Hi guys, how's it going? I'm going to try to do this live through multiple different platforms tonight. I'm Dr. Qazi. I usually just do it only on TikTok, so I'm trying to see if I can get both of them going. All right, perfect. I think we're on both Instagram and TikTok. Awesome. Welcome guys, thank you. I'm Dr. Qazi. I do this every weeknight, and now I'm doing it on Instagram too. So if you know me, I am over in Newport Beach, or if I should say you don't know me, I'm over in Newport Beach, and I do mostly acne, I do scars, I do hyperpigmentation, I do a lot of that. I also do a lot with collagen as well. And so you can see right here, this is a patient who just came in yesterday for her second session. So this is after our first one session. Hi, Drop Dead Sarah, how's it going? This is after a single session over here. You can see this patient. This patient had a combination session where we did TCA Cross, where we did Subcision, and we did laser, where we did a combination of an ablative form of the CO2 laser and then fractionated CO2 and erbium laser. So you can see all that under a single session. This patient, he did 12 sessions of Clear and Brilliant over at a med spa type of place, and did almost no results. He said that it was like a phenomenal results after a single session with us, and he did that just back in January. So you can take a look over here in September now. Look at that great result. Drop Dead Sarah's asking, is makeup bad for skin? You know, it's a good question because I think that there's a lot of makeup that will actually end up overly drying the skin. And then when it overly dries the skin, you end up producing a lot more oil production. And then with makeup, you could have some bacteria on the surface of your skin, and then that could end up causing some acne. So in general, I wouldn't recommend it, but you could try more like tinted sunblock. You could try things like with zinc oxide, titanium oxide, iron oxide. That's potentially helpful. Can I take low dose Accutane after a cure to have better results? Yes, OC, you could, or you could just do tretinoin. Tretinoin is a really good option there. If you're kind of at least about 3 months out, I could put you on tretinoin. That's probably where I'd first start out with, and then we could see about doing a low dose Accutane. But absolutely, you could do that just to help with if there is still some oil production. Usually though, it's more of bacteria that's still on the surface of your skin, so we may have to do something else for the bacteria. What that involves a lot of times is something like dapsone or clindamycin, or maybe we would even do a combination of clindamycin and dapsone. Thank you so much, guys, for joining us, guys. I'm over here at Newport Beach, so we're showcasing these results right now. This is a patient of ours who did a single combination session. He just came in yesterday for his second session. Really happy. Sometimes he comes on over here, so I'm not sure. Actually, maybe flying back though. He said he's flying back today. So this is the after the first session. This is the result, and you're going to see it's going to get even better after a while. So you can take a look at this really amazing collagen stimulation. You can see that the scars are barely visible at this point after a single session, and it did take 9 months right there. What if there's no results in one session? I would say, to be honest with you, I haven't seen anybody with no results. I could say that there's sometimes that I would say that it wasn't enough of a result. That's true. I'll be totally honest with you. We have a few different things. So one, we have basically a warranty program with our acne scar sessions, as well as other lasers like pigmentation, for example. We basically, the way I do it is that in the future sessions are up to 55% off for things like laser, TCA. So that's because I didn't want to really just have you guys pay excess amount of money just to kind of repair scars. I was not looking to get, you know, $20,000 to $30,000 out of patients. I just want to get really good, beautiful results from patients. So that's the thing that mattered to me. And so really, future sessions are significantly discounted because I'm just so comfortable and confident in how I'm going to do that first session. I know that I'm going to really knock it out of the park, and I'm going to be trying to knock it out of the park really every single time. You do need other things. A lot of times you're going to need things for volume replacement. You're going to need to do things, you know, like Bellafill or fat transfer or, you know, Sculptra or Radius. You're going to have to do something for volume. And so that's pretty much, you know, the case whenever there's some scarring that's going deep. it's a lot of times not just destroying the superficial skin, but it's also destroying actually the fat underneath there. So that a lot of times requires us to do something for volume replacement. I think a lot of people are missing that volume replacement aspect for scars, and that's why they don't tend to get as good of results. And then there's other people who sometimes only try to do volume replacement, and they don't do the things that you need to do for the scars themselves, like the texture itself, which is, which involves laser, which involves TCA Cross, those type of things. So sometimes I've seen some people who say they didn't get enough result, for example, from fat transfer. Well, it's probably because I actually recommended also to do other things, but sometimes they pick and choose because of budget reasons, things like that. But we have to do things really in combination with each other so that we can really maximize those results. What laser is this? This is basically a ablative form of the CO2 laser. So you see those rough edges over here of the scars. You can see the really thick walls of the scar, and that's really where I use a strong form of the CO2 laser to smooth those down. And then I also did a fractionated form of the CO2 laser, where that means that there's little bits of gaps with the laser. And then I also did something which is called an Erbium laser, which is a little bit lighter, less heat on the surface of the skin. So I did all those in combination with each other, and then you can see that improvement over here. I also did Taylor Liberator subcision for this patient. I also used a Noker needle for this patient. I got to double check. I don't want to misspeak, but I got to double check on if I did excision for him. I just don't remember off the top of my head. But TCA Cross as well for those ice pick scars. Subcision would probably be best. This is under a single session. This right here is from January to September. This patient is in Texas. He comes over to me all the way from Texas, and then he came in to me yesterday for a second session. And so that second session, I did a little bit more laser. I did some more TCA, and I did a little bit more Bellafill for him. He's going to get a really wonderful result. He does have a little bit of acne. If it was nearby me, I would say let's do the cure laser. He also doesn't really want to do Accutane right now, so we're trying to manage that, which is some topical creams. But he still has a little bit of breakouts, which does prolong the collagen response. Sometimes if you have oil production, you don't get as robust of a collagen response. So that's one thing. But he has improved quite well. Is there any patient that do not respond to treatment at all ever? Not that I've seen, honestly. I know that there's some people who are a bit harsh critics of themselves, and I sometimes think that they jump the gun after a month or so, and they're saying that they haven't gotten enough of a result. I can say really confidently that I haven't had anybody that I've left with worse scars. I would never let someone walking around with worse scars at my point. I also find that there's a vast majority of the times it's very reproducible what I do. So I do it on one patient, I could do it on another patient, and I can get really excellent results. But there are some variables. Some things like previous smoking history could really affect your collagen response. Sun exposure could definitely affect your collagen response. So those things could absolutely factor into this. And I can't really be responsible for those type of things. And also ethnicity, genetics. Those things I've talked to you guys about that before. I do notice that certain ethnicities do tend to have a more robust collagen response than other ethnicities, and I should say a quicker response. But that being said, I still ultimately could get that great result though, ultimately. We could still do it. It just sometimes could take a little bit longer, or we may have to do another session more than I may have to do for someone. For example, South Koreans in general, and a lot of East Asians, they can have a faster response a lot of times. Do Hispanics have quick or slow response? I have had, especially with Hispanic women, I have a very fast response a lot of times. So I do actually see that. Sometimes men a little bit longer, but I ultimately do get it. I definitely see the fastest response with South Koreans. Like by far, it's like it's fun for me to do because I will do deep scars, and I see 3 months out that it's almost scarless. So I can see it pretty quickly. And we can ultimately, again, get these results in other skin types, but there's some things that don't necessarily, so there's some ethnicities where it just may take a little bit longer. How about fractional laser? I did 2 sessions and didn't notice much of a difference. Yeah, by itself, it's not gonna help enough. I did do fractional laser with this patient, but you notice I also did other things. I did TCA Cross, I did Subcision, I did ablative CO2 laser, I did fractional CO2 laser. I also, in his case, I also did some Bellafill through the laser channel holes. I placed a dilute form sculpture as well. So I did a lot of different things all together in order to optimize those results. So laser was really was important, but it wasn't like the most important, especially pro-fractional laser was more for like a smoothing and blending effect. Bellafill or Radius, personally I prefer Bellafill for like more discrete spots. Radius is more when like I find that there's a little bit more laxity in the skin. So basically, if the skin quality itself is a little bit looser, I would say that I would do a little bit more Radius. Let me see. I think I'm missing some questions here, so I'm going to try to hit some of the ones that I'm missing. Let's see here. Just pace yourself. Oh, someone's saying, do lasers remove facial hair? Not these ones. They don't afford that. Someone's saying that they couldn't probably afford it. So the prices are on our page. Most patients do spend about $5,000 to $7,000 for their scars. Most patients do. So hopefully that gives you an idea of what you can expect really with us. Let's see here. I'm going to try to get to some more of these questions here. What about Indian black and white skin? So it varies. You know, I've had some Indian patients that have had very fast response. Again, women tend to seem to have a faster response than men. Others, especially I should say men, it could take a little bit longer sometimes. It tends to be thicker skin, oily skin. I think that factors in a lot too. Thick, oily skin could take a little bit longer. So that could be a bit of a factor. Black skin, African skin, I have great results actually, really, really beautiful results. The challenge though is that you can't usually use as much heat and energy. So it's not so much that there's not as much of a collagen response, but it's just that sometimes you have to hold yourself back a lot more than you could, for example, in this patient who is a Hispanic male, Fitzpatrick 4, and we could kind of push it just a little bit more. Let's see here. How about pro-fractional? Oh, they eat a lot of bone broth. I think it does matter. I think bone broth is possibly a factor. I'm going to remove this chat box because I think it's too small. I'm trying this new platform actually, so I can stream on multiple things, but I don't think you can even see that chat box that well. So I'm going to hide that. For the Instagram folks, I'm Dr. Qazi again. I'm doing this. I'm going to start trying to do this more on Instagram as well. So I'm doing this every weeknight, well, Monday through Thursday, really. So Mo Ali is saying, what is the difference between CO2 laser and Erbium YAG ablative laser? CO2 generates a lot more heat. There's a coagulative effect. It basically is going at the blood vessels themselves a lot of times with that heat, and that's why you don't have as much bleeding. So it's basically coagulating. What that means is it's kind of burning down the blood vessels, and so you don't get as much bleeding with that. But there's a lot more chance of hyperpigmentation with it. Erbium YAG, the opposite really. It's still ablating. It's still going each different layer of the skin, but there's not as much heat. It tends not to go as deep all in one go, so you have to go multiple passes to get that depth. Do you recommend an antibiotic cycle prior, during treatment? Yes, I almost always do, basically, before that. Do you recommend laser treatment for Latinos? This particular result is with the Latino males, and a lot of my patients are Latino, so I absolutely get great results with Latino males and females. I'm able to do this in all skin types. That's really important just to recognize. I'm able to do this in all skin types. I know I missed a bunch of things. I have this type of scars. What do I do? So come to me, and this is what I focus a lot on. I do TCA Cross for this patient. I do Subcision for this patient. I did ablative CO2 laser for the patient. I did a fractional CO2 laser, a fractional Erbium laser. I did all these things in combination together. Can you buy any over-the-counter medications for what? What are you asking about for that? I missed it. Unrelated, but is glycolic acid the most effective treatment for KP on the arms? It could be, but sometimes you actually just try urea, something with urea. So you could try something with urea, actually. Rough and bumpy actually could surprisingly work well. Let's see, I know I missed a bunch of questions here, so I'm going to try to get back to these guys here. Sorry if I missed some things. How much was this patient's treatment? I can't say exactly the cost of each patient, but I could say $5,000 to $7,000 for the most patients. Do you recommend, Anna's asking, do you recommend Accutane? There's a lot of cons for it, but nothing works. So honestly, if you have cystic acne, you got to take it super seriously. That's the bottom line. I want you to do something for cystic acne. So, we have to do things for antibiotics, antimicrobials, topical or oral, Or if you have been doing that and you're maximizing those type of things, then you probably should do something where potentially you have to control the oil production better. Spironolactone is a good idea for there if you're a woman. You could also do a topical version of that. Winlevi is fine too. But the problem is that some people just are very resistant. So you have to do something like either Accutane, or you could do the Acure laser. The Acure laser works like Accutane without those side effects. So those are all options there. Please answer my question. Steph, I'm missing your question. Sorry, I had a bunch of people, so I'm going to try to go back to yours. What was your question, Steph? If you could repeat it, I'm sorry if I have to ask that, but oh, here it is. Mini facelift for rolling atrophic scars, already done every other treatment. Well, if there's a lot of laxity, if you're feeling like you're pulling back your skin and you could feel like it's you see how mine snaps back there, like it snaps like that? If you're doing that and it's just like stuck a little bit and still pulled, then you probably do need a facelift. But mini facelifts aren't that valuable in general. They don't tend to last as long. They're not really pulling and restructuring the muscle quite as well as you would for a traditional facelift or a deep plane facelift, for example. So I'm not so sure about the utility for something like a mini facelift with scars. And it depends also, like I said, on how much laxity there is, how much loose skin there is. So it's tough to really be able to say. Let's see here. I know it said, good luck I'm having with similar things like hormones and PCOS. So PCOS, try to do spironolactone. Definitely try doing that. Hi, do you have any stretch mark examples if you still do them? I do a lot of stretch marks, actually. I got to take a look and see what if I have some results. They tend not to show up as well on photos, honestly. It took me a while to kind of figure out how to do acne scar photos. So I'll take a look and see how we could do better photos for stretch marks, because I feel like we just never really get great photos for that, but I'll take a look at that. What's the difference between Bellafill and other fillers? It's not really a traditional filler, really. Bellafill is really cow collagen, and it's also mixed with something called PMMA. So 80% of it's cow collagen, and that cow collagen basically teaches your body how to make natural collagen. That's what makes it amazing. And then because that PMMA, it's always going to stay there to restructure and remodel scars. So it's really nice and really valuable. So even if you lose a little bit of weight, a little bit of volume, you're still going to have some sort of support for your scars. Really nice, actually, for a lot of patients to be able to have that opportunity, where if they're losing weight due to the scars, they still have that there. I know I missed some questions here. J-Boy is saying, do you recommend laser treatment for Latinos? Oh, how many treatments and what is downtime? So this was one treatment for this patient, and then I did it back in January, and then he came in September for us. Let's see here. I know I missed so many questions here. Thoughts on laser genesis? Really pretty useless for vast majority of these type of treatments. I hardly ever use it. Definitely would not recommend it for scars, to be honest with you. Let's see here. Do you have to keep getting Bellafill, or is once enough? Well, you do have to correct it to a certain point, but I wouldn't say that one is enough really, because a lot of people have a lot of volume loss. So one is probably not going to be the magic number for the vast majority of people. But that being said, once you do get that correction, very minimal then you have to do outside of the fact that you're going to have some aging, as you go along. But beyond that, I doubt that you're going to have to do too much more. I could say really certain areas you're probably not going to have to touch again and again. Let's see here. I know I missed something. How about punch excision? Recommend, yeah, for deep little scars, deep scars, like more like beyond the depth of maybe like 2 millimeters, for example. You probably should do an excision, just literally physically take out the scar. Sometimes it's really good for boxcar scars as well. Really just pull out that scar completely. So it's good for that process. Anna's saying, I use pills I got from the dermatologist that clear up my acne. Is there any over-the-counter pills? Probably not so much really over-the-counter pills for acne, to be honest with you. But you could try other things like different is over-the-counter. You could try that. That could potentially be a good idea for you. Is Bellafill different from HA fillers? Yeah, basically Bellafill is not drawing in water. Hyaluronic acid fillers draw in water. That's how they work. Bellafill stimulates collagen production. That's how it works. So two totally different ways, two different processes completely. Let's see here. I'm going to kind of answer some of these questions here. I use pills. Let's see here. I know I missed up so many questions here. I'm going to try to get to everybody's. I'm doing these multiple different platforms, so there's things coming from multiple different sources here. Let me see if I could get everybody. How many sessions of Pico lasers get rid of two-tone lips? It could take 3 to 6, honestly, sometimes. Although you do get improvement even after a single session sometimes. So it could take 3 to 6 sometimes. I know I missed one. What do you think of Fractional with only 1550 wavelength for acne? Probably not going to help too much unless it's pretty superficial. Curious what types of jobs and careers people have to afford these. These are regular people all the time. We do take almost everything, honestly, almost all different forms of payment. So in terms of credit, we do things with, but they don't even check credit properly. So we do cherry, we do care credit, we do everything. So there's a lot of different options. So I think you could probably find something that's going to work out for you. Let's see here. Mansa saying, I just transitioned to low impact, focus on eating 30 grams of protein in the morning. That seems awesome. You're doing amazing, super helpful, awesome. I'm so happy that that's the case for you. So yeah, I mean, this is what I do all day long. I haven't even showed these results yet. I'd like to show you guys first before we even show it, just so you get like a taste. Is T Chan saying, is Taylor Liberator necessary, or do you think superficial subcision would work as well? Well, this patient, I always try blunt cannula subcision, but these are very, very deep scars, and so we have to do Taylor Liberator. Neil is saying, how do you get rid of hyperpigmentation at the base of boxcar scars? So pico laser is probably the best option really for that, but we would do is a little bit of pigmentation cream initially around there, and then we could use the pico laser to pick that up. Jay Dre is saying a difference between laser-assisted scar repair complex versus fractional laser, and can it damage melanated skin? So we got to be careful whenever we're using laser. The way I'm doing the laser-assisted scar repair complex, typically I'm using Sculptra. Sometimes I do it with Radius, but that's usually what I do is a dilute form of that through the laser tunnel holes. And I'm doing that with the fractionated laser, so really they go hand in hand with us. Let's see here. I know I missed so many things. I do think we should talk, maybe because some of you guys are coming from Instagram and things like that. So I think what I'll do is I'll talk a little bit again, probably tomorrow. I'll talk again about Subcision, Taylor Liberator Subcision, talk about the process, how I do it safely, how we should do this effectively, because I think that there's a lot of confusion about how to do it. And it's something that's, I believe personally, really necessary for a particular patient. I think that there's a way to do it though. It's not for everybody. It's definitely something that I don't take lightly, and I don't recommend it for everybody. But if it is necessary, we just that's the best way. That's the best thing to do sometimes for patients. To be honest with you, Taylor Liberator, if it's stuck, really pulled down, is going to help break up that scar tissue and then help you smile more effectively. My patient today, he was in tears because he had significant volume loss, significant tethering. And I was explaining to him that you couldn't even smile, you can't smile fully. He's like, yeah, that's been my number one problem, that I can't smile as fully as I want to because the scar tissue is over there and stuck. And that's unfortunate. So I hope we could solve that. It's only solvable by doing certain treatments and doing it properly and doing it very effectively. And that's what I do. That's the way I do it. The way I do it is very, very focused. And I make sure that every single patient that's on the table with me, I'm going to make sure it's very, very thorough. And, I go through it incredibly at a very, very high level. And that's why I think that really, in order to do this at a very high level, you really have to do a lot of this, and you really, really should be just focused a lot on this. So otherwise, what's going to end up happening is that you're not going to have your skills as high of a level as, somebody who focuses on things. Personally, I think that there's an element really where we recognize people who do quality work. Really, when it comes to anything, it's like we recognize what is done at a really meticulous level, and I try to do that. I think that people just recognize what quality is, and I always wanted to just aspire for that quality process. I don't know if you guys ever read Zen and the Art of Motorcycle Maintenance, but that's this whole theme of this whole book, basically. Just when you're doing your job, you really want to make sure that it's at a high quality, at a very, very high level, and whatever you're doing, you might as well do it that way. Otherwise, there's no real point of doing things. That's kind of the concept that he has. I think it's a great concept actually, and it's like he's like sitting there building his motorcycle, and he just loves doing it, and it's fun for him. And it's exciting for him, and that's why I do these things, and that's why I talk to you guys about this stuff, because it's fun for me. It's like, believe me, there's so many other things that I could do. There's a lot of cool things that I could do in life, But like, this is fun. I like this. This is like, I'm doing it and like changing lives, and it's like exciting, and so it's like rewarding for me. It's not like I'm sitting here like with a missile factory and building missiles that are or drones or something like that that are going to bomb little kids. I'm doing things that are actually going to help and solve individual problems and help people achieve their best possible version. That's really what my goal is. Really, I want people to not have this hold them back, and it's where we're getting at. I think that's really, really fun and rewarding that we could do that. T. Chan is saying, for pigmented ice pick and boxcar scars, what did you pick before TCA Subcision laser? We would do it all together, usually, all at one time. We would typically do that there. So typically all at once when we're doing that. All right, guys, I'm going to wrap up for tonight. This went well, though. I'm glad I did it on both. Thank you, G. Good seeing you on. I'm glad I did this on both TikTok as well as YouTube. I don't know if actually was live on YouTube. I don't think I got the comments on YouTube. I got to double check to see how I do that still. But I definitely did it on Instagram, and I did it on TikTok, which is cool. My first time doing that. So thank you, guys. Kat saying, my acne scars haven't held me back, but I definitely want to be the best version of myself. Awesome. I hope you do. Yes, I'll try to find stretch marks transformations for you. Thank you, guys. Thanks so much. Take care. I will see you again very soon. I'll see you tomorrow night. Thank you.